Hi everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today, and we're excited to be talking about interoperability. And our special guest is Kathryn Ayers Wickenhauser. She's Director of Communications at DirectTrust. Welcome, Kathryn.
Thanks, John, for having me.
Yeah, so before we dive into interoperability, and actually an exciting new initiative you have, but tell us a little bit about yourself and DirectTrust.
Sure. So at the heart of DirectTrust is instilling trust in healthcare communication. So I think we all can agree that secure, accurate, and expeditious communication is really important. That's a lot of what we're talking about here at HIMSS and a lot of what we're trying to solve in health IT. So DirectTrust really is focused on doing that and being a trusted exchange mechanism. So we are the custodian of the direct standard, which many know as direct secure messaging. And we do other things too. So we are a membership organization first and foremost, but we're also a trust framework, and that is the technical trust that allows for that secure and trusted exchange, as well as a standards development organization. So I was just talking to a friend and she said, you know, Interop is all about standards. You know, that's how we get to interoperability. And so DirectTrust is one of those organizations that's creating the standards. So we have the direct standard and several others in process. And then we're also an accreditor. So basically we ensure that the health information service providers, the HISPs, that operate the DirectTrust network and help the exchange of secure information, that they meet certain policies and certain standards. And so we're the ones who accredit them. So membership, standards, trust framework, and accreditation. That's essentially what we do at DirectTrust.
Yeah, and I think it has been a theme that a lot of people are talking about is trust. Because it's one thing to have a standard, but if no one uses it, if they don't trust it, then it doesn't matter. So I think that's important work.
Exactly, and I think that might be kind of the hot word of HIMSS. I think there's a lot of social determinants of health and health equity, but trust has really kind of cropped up at this event, and this is always what we've been about. So many people know us for the first part of our name and direct, but really the foundation of everything that we do has to do with trust, and that's who we are as an organization, is helping facilitate and create that trust.
Yeah. So you have a new initiative. It's an Interop Hero initiative.
Yes.
Tell us a little bit about it.
Sure. So, I think so often in interoperability and health IT, we're focused on the numbers. And so we see the progress, and DirectTrust in particular, every quarter we announce our metrics. So we say, this year and this quarter we had this many direct secure messages exchanged, here's how many addresses exist, et cetera. And that's wonderful, and you can see progress. But there's also another side to that, right? There's the people behind those numbers. And when we get back to the why of what we do and why we're in healthcare and why we're in health IT and helping providers and helping patients and thinking about there's more to that, there's more to those numbers, there's the stories. And so Interoperability Hero really came out of a desire to recognize the people who are making this progress, because it's impressive, the progress that we're making in interoperability and the leaps and bounds that we've all made, but people are responsible for that. It's not just technology, it's the people implementing that and that making a real difference. So we wanted to make sure that there was an opportunity to hear those stories and to recognize those people. And just walking the halls here at HIMSS, thinking about everyone who's around, they all have their own unique contributions and things that they're doing. And so Interop Heroes is really to recognize those people and to elevate and share their stories so that we can humanize what we're doing and why we're doing it and get back to that why.
Yeah, I like that. I mean, you send billions of messages and each message represents a person.
Yes.
And it's facilitated by just hundreds of people who are doing really hard work.
Yeah.
I think people don't understand how hard it is
Right.
to do the standard, to reconcile the standard, to interoperate with multiple. So I think this is really a good initiative. So who could be nominated as an Interop Hero? What's the criteria? What should people think about if they, maybe they know someone that's deserving of recognition?
Sure. We would love any nomination possible. So to nominate someone, there are two criteria. So it's super simple. The first is that they need to fit into one of a number of categories. So currently we have 10, and they range from advancing interoperability to alternative to facts, to identity proofing to get more technical, and even use with other standards. So using direct with FHIR or query and those types of stories. So there's a variety of wide-ranging categories. So fit into one category, and then an exemplification. So that can be a metric, it can be a number and showing progress, it can be a story, it can be a document, it can be a variety of things. So basically, fall into a category and provide an exemplification, and then those who meet the criteria will be recognized as Interop Heroes.
Yeah, so how are you going to recognize them, and why should someone nominate?
Sure. So I think we all have those people in our organizations, and we see the people doing hard work all the time. And like you said, advancing interoperability, it's tough stuff. And I think it's wonderful to give a pat on the back to those who truly are making a difference and show that we recognize their efforts. That can go a long way. As well as, I think it also creates an opportunity to learn from others. I'm a big believer in collective wisdom, and especially as a membership organization, we learn from each other. And so sharing some of these stories, you see what's possible, and it sparks an idea, and then it just is a catalyst and leads to more. So I think nominating those people who are doing cool things and sharing those stories is wonderful. And then really, we want to hear those stories, and what we'll do is every quarter, in conjunction with our quarterly metrics, we'll announce those Interop Heroes. And so the idea behind it, we talked about metrics, we talked about the numbers. This is something that we've been doing since 2014, where every quarter we announce the metrics. And so you see the data, you see the numbers, but like you said, considering that each message represents a patient or a patient interaction, what are the stories behind those numbers? And so this gives us an opportunity to pair kind of the analytical of what happened over the past quarter with the anecdotal, and here's some of the cool things that are happening. So for instance, social determinants of health, obviously a big topic right now, and seeing some progress there. COVID-19 response and pandemic response, and some of the people we had nominated for this last class, they had significant efforts there. So I think it just sparks ideas, and then so we'll recognize every quarter and go from there.
Awesome. So do they have to be a DirectTrust member to do it, or do they have to use Direct, or what's the criteria as far as that's concerned?
Not at all. So I believe that at DirectTrust, we believe that a rising tide lifts all boats. And so we're very supportive of the Interop community as a whole. And this is not meant to be a membership recognition campaign. This is not meant just to be for DirectTrust members. This really is to learn more about the stories that are out there, and the people who are on the ground doing the work. So for instance, in this past class, we have UPMC, University of Pittsburgh Medical Center, and Sutter Health, and they both did two different things, but listening to what they did and how it made a difference in their organizations and communities, that was really cool. Some of the other Interop Heroes from this last class, they do work with HL7 and with FHIR and Commonwealth and Care Equality. So you can already see in this first class that it is a wide swath of people. It's not just for DirectTrust members. It's not just about direct secure messaging. It really is recognizing those true Interop Heroes in any capacity.
Yeah, so how can people nominate? I assume they go to the DirectTrust website, or?
Yeah, so the best way to do that is to go to the DirectTrust website. We have a contact us form, and to fill that out, let us know that you want to be notified when we open the next round. So every quarter we'll open for a period of time the nomination period. So it's not ongoing. We'll make a big deal out of it. You'll see it on social media, so make sure you follow us there to be notified. But we'll open the nominations for a period of time, and then ensure that the criteria is met, the standards are met that we've set for Interop Heroes, and then in conjunction with our quarterly metrics, that will be the announcement. And then over the next quarter, we'll do spotlights on those stories. So it's not just the press release, it's more than that. We really want to dig in deeper and hopefully have some video interviews and learn more about what they're doing to really inspire others.
Yeah, my gut tells me you're going to probably include some of them at the DirectTrust Summit. That would be
a
reasonable assumption.
Yes.
No, I think that's really cool. Is it a lengthy process? I mean, some of these, in healthcare, we love to overdo things. But like, is it a long nomination, or what? What's involved?
So, we actually this has been ruminating for about a year.
Okay.
And we brought it to our marketing and membership work group. We talked about it with our innovation priorities work group. Our strategic planning committee talked about it. There have been lots of different people involved in making sure that this really represents what we want it to be. And so part of that was making sure that the nomination process was as simple as possible. So it's those two criteria. It's checking the box of a category or categories a nominee falls into, and the exemplification. And that can be as short as you want, or it can be as long as you want. But I think what we're finding with these nominees is that they've done a lot. It's typically not any one single thing. And we want to know about that. We want to share those stories. So we intentionally made sure that it was an easy process.
Yeah, I love that you're sharing them, because I think it could inspire other people that like, oh, is that possible? Or even, I'm not alone in this this process of trying to solve this interoperability problem in healthcare.
Right. Yeah, I agree with that.
Awesome. So if someone wants to learn more about DirectTrust, what should they do?
Two things. So the first thing that I would encourage someone to do is check out our website, and you can find a variety of materials there. We have resources about what direct secure messaging is. If you are using direct and you call it something different, your EHR calls it something different, we have a crosswalk so you can understand, okay, well, this EHR calls it this and this EHR calls it this. So that's there. Just a bunch of educational materials are available on our website, infographics, explainers, fun stuff. And then the other thing that I would encourage someone to do is follow us on social media. I mean, we share stories, we share new resources all the time, and so then you can kind of keep a pulse on what's happening. Our organization has evolved a lot since we were founded in 2012. We're about ready to celebrate our 10th anniversary, which is it's crazy. And it's exciting. And recently someone said to me that so much had changed since 2016, and that was about the last time that she paid attention to DirectTrust, and it was kind of stuck in a time capsule in her mind. And then recently she came to the DirectTrust Summit, and she had no idea how much we had expanded and what we were doing now. And it's not just about direct. That's what people know us for, but so much of what we're doing is about trust and ensuring that we can have trusted communication. So I really encourage people to take a look at us if they haven't recently. Check out the website, follow us on social media. That's the best way to get reacquainted with us.
Awesome. Well, I love the initiative, and thanks so much for sharing it with us.
Sure. Thanks, John.
Yeah, and thanks everyone for watching. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com. Thanks, Kathryn.
Thanks, John.